Welcome to Reimbursement. Show me the money, because that's what reimbursement is. But let's just get a little more information about this, okay? What is involved in this process? And the first thing that's involved is you understanding what healthcare really is composed of. Medical care is the provision of care to someone who is injured or ill. Preventive care is care that is provided to a healthy person to keep them healthy. And put those two things together, and that's how you get health care. So who all is involved? And if you haven't heard the term third-party payer yet, now is your opportunity, because you will hear this a lot, especially in this class, as well as the industry. So how do we get third-party payer? Well, the first person who's involved in a healthcare encounter is the physician or the healthcare provider. The second person involved is the patient. This is the person seeking and receiving services. And now we get to the third party. The third party is the insurance carrier who is going to pay for this encounter between the physician and the patient. And that's how we get third-party payer. Their only involvement in this encounter is paying for it. In addition, you need to understand that not all third-party payers are actual insurance carriers. For example, Medicare is not an insurance plan. So that is why you will find that we often use this umbrella term of third-party payer to include not only the insurance carriers such as Aetna and Prudential and Humana and United, but also to include the non-insurance payers like Medicare, Medicaid, TRICARE. There are many different types of insurance plans that you will undoubtedly work with in the reimbursement process for your healthcare facility wherever you work, whether it's a one-physician office or a big, huge hospital. And some of these insurance plans are health maintenance organizations, preferred provider organizations, and point of service plans. These are explained in your textbook, and you really need to read about them so you understand the parameters of each of these types of plans. And by the way, if you have a choice, this understanding will help you make a better choice for your own personal insurance coverage. The government plans, as I mentioned before, not insurance, but they do pay for healthcare services. And these include Medicare, Medicaid, and TRICARE. Now, I gave you little hints here to help you remember the difference between Medicare and Medicaid. And if you look at Medicare, the last two letters are RE, and that's the first two letters of retired people who are over the age of 65, generally speaking. So if remember, the RE in Medicare is RE as in retired people, that'll help remind you that Medicare will pay for people who are over the age of 65, also people with a permanent disability, and those who have been diagnosed with end-stage renal disease. On the other hand, Medicaid, ID at the end, covers or pays for healthcare services to indigent people who are also known as low income. And TRICARE covers the dependents of active duty service members. There are also other types of insurance that are not really considered health insurance, but still may be involved in the payment of services to your physician's office, your hospital, your long-term care facility, whomever. And that includes workers' compensation, disability compensation, and liability insurance. So, if you have any questions about these, please ask your instructor. I promise you, if you have a question, so do other people.